Okay, good afternoon, everyone. I'm Bayu Anggileo Pramesona. I'm from Universitas Lampung. So today I'd like to present my research entitled Reasons for Low Patient Safety Incident Reporting Among Indonesian Nurse Qualitative Study. So, ladies and gentlemen, as we know that a patient safety incident is defined as an intentional event and condition that result in or has the potential to result in preventable injury to a patient. And patient safety standards are mandated in hospitals and are enforced through incident reporting. However, patient safety incidents are still underreported in some countries. Some of reasons such as fear of punishment, lack of knowledge, lack of time, and excessive workload, a lack of role models, lack of response from leaders, and the belief that reporting is not a part of nurse job uh, are the main factors of the incident reporting. And in Indonesia, studies on patient safety incident reporting are uncommon. Previous studies were mostly quantitative and provided information based on statistical findings. So the purpose of our study was to investigate the critical reasons for low patient safety incidents, reporting from the perspective of clinical nurse. This qualitative case study design was conducted in July 2020 at a district referral public hospital in Lampung, Indonesia. And we recruited 15 clinical nurses, both from inpatient, outpatient, and emergency department, purposefully. And we also developed semi-structured interview questions. And the interviews were conducted in Bahasa Indonesia through face-to-face in-depth interviews lasted between 50 to 60 minutes and were voice recorded. And for data analysis, we use thematic analysis and we obtained the ethical consideration from the Health Research Ethics Committee from the Faculty of Medicine, Universitas Lampung. As the result, we found that eight terms were emerged in our study. The first one is understanding of the incident reporting. Second one, the culture. The third one, consequence of the reporting. And the fourth one, socialization and training. The fifth one, facilities. The sixth one, feedback, rewards and punishment. And the last one is ignorance. And for the understanding of the incident reporting, we found that mostly respondents have a comment like there is lack of understanding about the importance of incident reporting procedures and their contents. And for the culture, mostly our respondents state that they were afraid of being blamed by others, and in hospitals, the reporting culture has not been well implemented. And for the third term, there is a consequence of reporting. Mostly our respondents were fear of litigation by patient or their family. And also they had fear of being transferred to another hospital unit. And for the fourth term, that was socialization and training, we found that mostly the respondent respond like in terms of incident reporting, there is lack of socialization and training. And for the facilities, our respondents state that there were insufficient facilities to support incident reporting. And for the feedback was mostly slow or even no feedback at all. And in terms of rewards and punishment, mostly our respondent state that there were no incentive or penalties at all. And for the last one, ignorance, mostly nurses are simply ignoring this issue because hospital management has provided no feedback on reported incidents. And then the next response was inadequate understanding of the significance of the incident reporting. And the last one, the ignorance was happened because there is no rewards nor punishments at all. So the motivation was decreased automatically. For the discussion, in another study and several studies with similar findings in Indonesia highlighted a lack of knowledge and skills related to the incident reporting, such as what should be reported. and how to report it. And nurse must be knowledgeable and follow all applicable standard operating procedures. And for sure, hospital administrators must address staff with educational intervention that actively transfer knowledge. And in terms of blaming culture, yeah, the shaming and blaming culture may exacerbate the reporting culture for patient safety incidents. And the fear of being blamed or punished has also been identified as major cultural barriers in some previous studies. And positive culture, for sure, is required to raise individuals' awareness of the importance of reporting incidents. The very high risk of litigation in healthcare sector combined with elements of special effort becomes a powerful motivator for reporting actually. And according to the previous study, most healthcare workers identify fear and reluctant to report as cultural barriers. And the socialization and training on incident reporting are required for all staff, including nurse, to reinforce what has been taught. And for achieving this issue, hospital management leaders should provide educational interventions such as in-house training. And in terms of the feedback response, the organization attention, including the provision of appropriate facilities, can help nurse report incidents more easily. Organization must put in place a solid system to ensure that patient safety is a top priority. Because feedback informs people about their activities, a lack of feedback can adaptedly explain poor incident reporting. And lack of feedback has previously been identified as a flaw in incident reporting. So in safety culture, people are rewarded for improving safety as individuals or as members of team. Another reason staff are unaware of incident reporting is a lack keywords and appreciation as the result, no positive change will be happen. Yeah. And for the limitations and the contribution to the field, the findings cannot be generalized. So considering our sampling techniques was purposive sampling, so future research can be conducted to investigate the experience of nurse group from a larger population as a suggestion. Yeah. Given nurse perceived reasons for not reporting patient safety incident, nursing managers must provide effective guidance for their subordinates to report patient safety incidents openly and actively. The findings of this study can help healthcare organizations create a positive work environment that encourages nurses to report patient safety incidents. And as conclusion, in this study, some of the specific reasons for low patient safety incident reporting were less understanding of incident reporting, blaming culture, fear of lawsuits, lack of socialization and training, inadequate facilities, no feedback, no rewards and punishment system, and ignorance to reporting the incident. Finally, this finding should be viewed as a challenge for the patient safety committee and hospital management leaders in order to increase patient safety incident reporting in hospital, particularly among Indonesian nurses. So thank you very much for your attention. And as a reminder, safety is in my hands, so everyone can do these things properly. Thank you very much.